Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Dirito, a family physician. I have interest in cancer prevention and also treatment and public health. In this video, we are going to talk about bladder cancer. We are going to look at who gets bladder cancer, how does it present, what are the treatment modalities available for bladder cancer, and how can you prevent yourself from getting bladder cancer. The bladder is a hollow organ which is found in the pelvis or the lower part of the abdomen, which stores urine. It is usually composed of the three layers, which include the mucosa, the muscle, and the outer layer. It usually collects urine from the kidneys through the ureters and expels it through the urethra. So let's look at who gets bladder cancer. Worldwide, about 573,000 people get bladder cancer annually. It is more in men than women, with a male to female ratio of 3:1. It is the fourth most commonest cancer in men, especially in the developed countries, and it has a high level of recurrence. So what causes one to get bladder cancers? There are some factors that increases one's risk of getting bladder cancer. 50% of the cases of bladder cancer, the risk factor is with smoking. Then you have some chemical exposures, especially industrial chemicals such as dyes and paints for people who work in this type of industries. Then we have chronic infections, which you have long-standing bladder infections, conditions like cystosomiasis or bilharzia can increase the risk, infection with the tuberculosis in the bladder, and also chronic bladder infections. Then you have those who have been exposed to radiation, especially if you have been treated for previous pelvic cancers like prostate cancer and also cancer of the cervix. Then there is also a family association of this cancer, those who have some particular genes at increased risk. Then how is bladder cancer diagnosed? So to make a diagnosis of bladder cancer, there is usually the history, which is usually a history of blood in urine. Then the gold standard of diagnosis is looking into the bladder, or doing what we call cystoscopy, where a flexible tube with the light is inserted through the urethra into the bladder, and the urologist can easily see the bladder walls and detect the areas where there are lesions in the bladder wall. Then of course, for imaging, you have ultrasound. You can also do a CT scan or an MRI, and this will help in diagnosing the cancer and also establishing its extent. Then of course, when you do the cystoscopy, you can also do a biopsy where small tissue is taken and observed under the microscope. So how does bladder cancer present? Usually, as I've said, it is commonly present with blood in urine, and this is usually painless. You can also have pain during passing urine, or a burning sensation. You can have increased frequency of urination, and also there is urgency. There is like pressure to pass urine. You can also have pain in the lower abdomen and discomfort. And of course, in the advanced cases, you have weight loss and bone pain if there is extension of the cancer to the vertebral column and other organs that around the bladder. Then complications include local spread, which it can extend to the prostate, it can extend to the uterus in ladies, it can also extend to the bowel or the area around the rectum. Then you can also have distant metastasis to the lungs, to the liver, and also to the brain and the vertebral column, leading to impaired sensation in the lower limb. Then this is a cancer that is known for its high recurrence rate, even after excision. And of course, if the bladder is removed, then you have urine diversion, and this has its own complications. So how is bladder cancer managed? The gold standard, especially in the early stages, is surgery, where you can have partial removal of part of the bladder which is affected by the cancer, or you can have removal of the whole bladder if there is extension of the cancer from the inner lining to the muscle and affecting the whole wall of the bladder. And then you can also have chemotherapy or immunotherapy. You can also have chemotherapy, and also you can have radiation. So bladder cancer is easily recognized because of its early presentation with blood in urine. So if you have any change in your urine color, then you should seek medical advice immediately. Quitting smoking and avoiding harmful chemicals, especially for those who work with chemicals, and the industries wearing protective clothing, and also spreading awareness so that people know and present for healthcare to seek attention. Thank you for watching. Please subscribe, share, and like this channel for more informative content. Thank you.